Okay, so this scenario is going to depict critical thinking. So in one of the units we floated to, my nurse preceptor and I had a patient who had a J tube and was receiving tube feedings through it at a very small amount of only 20 milliliters per hour. At home, the patient had been receiving 77 milliliters per hour. This small dose was being given because of concerns related to the usability of the J-tube at this time. The patient's abdomen was very distended and bile was escaping from around the J-tube. The patient was also on a ventilator and was under a light sedation because of the medication error with phenobarbital that had actually been committed by a nurse the day before we cared for this patient. In this situation, Izzy will be the patient's mother and I will be the nurse. Knock, knock, knock.
Come in.
Good morning, Mrs. Kleenex. How are you doing today?
I mean, I'm doing good, but poor Sue. I mean, she looks like she's not getting any nutrition, and she still hasn't woken up.
Okay. Has anybody been around to see the tube? Because I can see it looks very inflamed and looks
Yeah.
like the skin is breaking down quite a bit around it.
It looks horrible.
It does look horrible.
And the nurse from the prior shift, I keep grabbing them to have them look at it, and she says some skin team is going to come see it.
Okay. Well, I am going to go call that skin team right now and see if they will be coming today or when they will be coming, just to make sure that you're here during that time when they come, because I know that this is very important for you and Sue with this skin breakdown.
Yeah, I want to see what they have to say.
Okay. Well, I will go call them right now. Is there anything else that I can get you for right now?
Besides the skin team, no.
Okay. Well, I will go give them a call and see what we can do. All right. Ding, 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 ding. Hi, my name is Stephanie Duregger, and I am taking care of Sue Smith in room 101. I was wondering if you were still planning to come and look at her J-tube site. I don't know if you have any idea about that. We have actually been having to replace the gauze around the site about every hour because of the extensive drainage. The skin around the site is actually really broken down from what I'm assuming is bile coming from there. The color is kind of a fire engine-y red, and I really think that it would be beneficial for you to come and look at it.
Okay. I mean, I just took a look at it, and my colleague was supposed to stop in yesterday, but I don't know if she ever went around to it. I'll stop by this afternoon.
Okay, that would be great. Do you happen to know what time that might be?
Anywhere between 2 and maybe 3:30.
Okay, thank you so much. I will see you then. Bye. Knock, knock. Come in. Okay, so Mrs. Kleenex, I just talked to the GI team, and they are planning to come around this afternoon to look at this site. So until then, what we're going to do is we're going to keep replacing the gauze to just really prevent infection at that site, maybe clean it a little bit, and just to really prevent infection. And then another thing that we can do, since she has been receiving the tube feedings at such a low rate, I am kind of worried about her nutrition at this time. And some of the risk factors for like skin breakdown can be inadequate nutrition and not moving around a lot. And since she's pretty drowsy right now, that's something that we're really going to work on until the doctor comes. He said that he would be here around like 2 to 3:30, somewhere in that range. So if you want to be here at that time, since I know that you're kind of Sue's primary caregiver at home. So until then, we're going to really think about skin and really try to see what we can do related to repositioning until we get a plan for this skin breakdown, because it's really important to think about infection at that site, especially because that's where she receives her nutrition. So, do you have any questions?
So you said between 2 and 3:30?
Yes, yeah.
Okay.
Yep, somewhere around there.
Okay.
So, is there anything else I can do for you?
Not right now.
Okay.
Thank you, though.
Yeah, Sue, is there anything else I can do for you? Okay, we'll just let her sleep for now. So, all right, thank you so much, and I'll be back in, and the call light is here if you need anything. And I'm going to get one of my other team members so we can reposition her a little bit. So, thank you.